I guess what are you seeing in terms of COVID in the Duke system right now?
Yeah, I mean, I think actually quite similar to lots of other parts of the country, we've seen just a little bit of a rise again, unfortunately. And that actually has been exactly the same timing of when we saw a rise in late July in 2020 and again in 2021. And so maybe maybe this is the frequency of when COVID starts to come back a little bit. How it's presented is that it's been just a slow increase in the number of people who sadly come back into the hospital, some of whom have made it into the intensive care quite sick. It's nowhere near the magnitude of what we saw in some of those early years of the pandemic, thankfully. And it has generally been a bigger problem for folks who are high risk. So if you're someone, one of our many patients, frankly, who's undergoing transplantation or on chemotherapy, for example, or actually nursing home residents are the other folks who sort of still seem to be disproportionately hit hard. That some of those patients, unfortunately, are still coming into the hospital. So a little more frequent, not as bad as what we've seen in previous years, but enough of a reason for folks just to be conscious that this still exists and around in the community and be sensitive of your symptoms for sure.
Do you have any ideas why maybe we are seeing that increase heading into these warmer months as we've seen the past couple of years?
Yeah, I mean, there's likely to be two things going on there. The first is that there are some viruses that naturally sort of have a biannual cadence. They sort of hit hard in the winter, and then there's also a little peak in the spring or the summer. So it may be a viral phenomenon, firstly. The other thing I think not to underestimate is social behavior. It's always interesting to me that this has occurred just in the couple of weeks after sort of July the 4th holidays, when people are out congregating, mixing with people from different social circles again, maybe the trips to the beach, or like lots of interactivity. Teasing apart how much of this is the virus, how much of this is us, how much of this may be simply a collective relaxation a little bit and dropping our guard somewhat, I think probably also plays a role there. But it's interesting that this is now sort of the fourth year in a row of third year again, fourth year of consistent sort of late July, early August, just a little peak again. And I think that we need to be mindful of
that. What effect has vaccination had on the cases that you're seeing now that we are a couple of years into people being vaccinated?
Yeah, I mean, I think reassuringly, it's had an enormous effect. Most people who still call or contact me to say they've currently got COVID are actually doing okay. And so, for the general community, that's the thing to remember, is that vaccines have had whilst at this point, probably a moderate impact on your risk of getting COVID, they still have had a profound effect on the chance of you having that sort of really severe COVID that's landed you in hospital. The group who that's not relevant to, sadly, is those people we talked about earlier. So the immunosuppressed people or individuals who are old enough, particularly sort of over 75, over 85, that their immune system is just more sluggish at that age. They don't respond as strongly and as durably to a vaccine as maybe you and I do. But I think in the general population, look, we know in the US there's comfortably more than 95% of people who are either now multiply vaccinated, multiply infected, sadly, or both. And for those individuals, generally people who are fit and healthy, this has sort of normalized into much more of a consistent illness with a standard flu. So vaccine in that regard has had a big impact. It's probably also had an impact, although it's harder to tease out, on the rates of long COVID in the community. We still see a small, but for those individuals, pretty notable group of people who get left with really protracted fatigue after their COVID episodes, not to mention other symptoms. Vaccines do seem to have a reducing effect on the likelihood of getting those sort of long-lasting symptoms, but they don't remove it completely. So again, another reason just to be conscious of this.
You talked about how maybe attitudes have changed, or a relaxation toward our approach on COVID. I was talking with some friends and they were like, boy, if I started feeling unwell, I probably wouldn't even test myself. What should people do if they start to feel a little under the weather?
Yeah, I mean, I think that attitude is not uncommon, and heck, that sort of is a reversion to what we probably were all doing pre-pandemic in some ways, isn't it? I think you need to be still sensitive to, frankly, what your personal situation is, who's in the house with you, who's at work with you, and what's your own personal situation in terms of your immediate risk. So do I counsel my transplanted patients or my HIV patients or folks getting chemo to test for their visibility? Absolutely, because it helps me make smart decisions for their care. Do I do that in a nursing home situation? Absolutely, where we've seen transmission. Is it probably as crucial for the individual who's at home, fit, healthy, 20-year-old, works from home? Maybe that is less crucial. Not to say I think it's a bad idea to still have a few rapid tests in your house. I mean, I think it gives you that level of control over awareness of what your symptoms are related to. And people need to be at least sensitive that COVID's still a very large possibility, that if they come in with a respiratory illness, that's what this is. And then it gives you a bit of control, gives you control as to who you want to hang around with for those next 5 or 6 days while you're symptomatic. It gives you the right to, I think, appropriately and cautiously be respectful to grandparents or kids with young infants who are around you. And people make smarter decisions once they're given that information that says, yeah, this is what I've got. So I think there's a time where it's still very helpful.
Sure. Anything I didn't ask that you think is important to say?
Yeah, I mean, maybe the other part, honestly, is that we are getting ready for a modified booster again, come up to the late fall and early winter. So it's expected that probably late September, October, we knew that last year we had a modified booster that incorporated the Omicron variant. This one now again incorporates the sort of latest derivative of Omicron, if you will, called XBB. And I think it's a good reminder coming into the winter where things have been traditionally busier, and probably most people, frankly, are now more than a year from when they last had a dose. In fact, many people more than a couple of years. COVID's drifted a lot. COVID today is immunologically not the same as what we saw in 2020. So I think people shouldn't rest on their laurels and assume that because they were vaccinated in 2021, that it actually does a lot of difference to them now. So that's the thing that people should look out for. I think that's expected to be released, as I said, around the same time as the flu shot. We've got plenty of good data to say that you can do both together and that they're safe. And in fact, down the road, next year, hopefully, that'll be a really good opportunity that companies are trying to plan to sort of fuse those into one vaccine, and be logistically enormously easier if we can just come up to patients who are at risk and say, look, hey, here's your winter respiratory viral vaccine, and you're done, and it covers each of these things. We're not quite there yet, but that's something that people who are at risk of COVID should be looking forward to seeking, I think, as we come into the fall.
Outstanding. Dr. Wolfe, as always, thank you very much.